Hey guys, my name is Scott Ferris. I'm the Director of Admissions and Sales here at Whitehall Nursing and Rehab. And I have a special guest here with me, Miss Ashley Hansen. She is our Director of Nursing with 5 years of service here at the facility.
Hi guys.
All right, Ashley, we've got a couple questions here for you. I was wondering if you could tell us a little bit about our physician and consultation services that we have here at Whitehall Nursing and Rehab.
All right, Scott. So what we have is we have a medical director, and that is Dr. Randall Voights, and he comes in about 3 times a week. And then his nurse practitioner comes in, and his physician assistant comes in, and they see on the opposite days that he is not here. So at least one day a week, we have some kind of a medical personnel in the building. We also have another doctor that comes to visit, and that is Dr. Mopaway from Greenfield. And he sees patients at Boyd, and then he'll come here and see his patients. He's in the building every Monday, and he's always reachable by phone or fax. We also have a wound nurse practitioner that comes in, and she works hand in hand with our wound nurse who has many years of experience in wound care. She's worked in a wound center, and she brings a lot to the table and a lot for our residents. She does a magnificent job. We also have our psychiatry, Dr. Habib and Amanda Milton, and she is the nurse practitioner. They come in about once a month, I would think, and we also have a behavior meeting that we do once a week. And that behavior meeting talks about, can we take a patient off of some medication to make their quality of life better? It just kind of varies. Sometimes we can do that, sometimes we can't, but we work hand in hand with our psychiatrist and our house director to be able to make that happen for our patients. We also have podiatry that comes in about once a month or once every 3 months. It just kind of varies on him. He's from the Chicago area, so he travels quite a long ways to come here.
Quite the character too. I love him when he's here.
He's entertaining, that's for sure.
Along with our physician and consultation services, we also have an expansive amount of nursing capabilities. So I wanted you to talk a little bit about our IVs that we take, and as far as like isolation precautions and surgical drain management.
Okay. So obviously we live in a different time now, so we have COVID, and that brings a whole different set of isolation to the game. So we are able to handle COVID positive patients. However, we have been very fortunate enough to not have any COVID positive patients, though we do have the capabilities. We also have the capabilities for anybody that has MRSA or ESBL or VRE or anything like that. So we can do, for the most part, we can do any kind of standard precaution that we need to, except when it comes to treating TB. Then we would need to have them sent to the hospital because they need that negative air pressure room.
Right.
As for IV management, we do peripheral and we do PICC lines. Our PICC lines are handled by our licensed RNs, and we have several licensed RNs in this building. We are very fortunate, very fortunate. Some facilities don't have a whole lot of RNs, but we do the management of that, the flushing. We run any kind of an IV that we can. We do have some stipulations though, and so you would just need to meet with us, and it's on a case-by-case basis. And we also do IM medication. So if you need a shot of Rocephin or an antibiotic or something like that, we handle that. We do JP drains, Jackson Pratt drains. We don't take them out, obviously.
Right.
They have to go to the surgeon for that. But we're able to handle drains and drain management, and we work very closely with the surgeons at the hospitals who are doing that.
And one big thing, like with our nursing capabilities here, is with our dialysis patients. We do provide transportation to dialysis appointments as well as other doctor's appointments to make sure they get there safely and securely, and as well as pick up new admissions or readmissions coming back to us from the hospital.
Yes, we're very fortunate. We have a great transportation team.
Yes. And some of the other amenities that we have on the healthcare side of things is therapy services here with physical therapy, occupational therapy, speech therapy, as well as a full dedicated restorative therapy program that runs weekly, and it's been very successful for us.
Well, and not only that, Scott, but they work hand in hand very closely with nursing as well. So that way, if we see a decline, we can tell them, hey, we have a decline, so then we can look up for restorative or for actual therapy to pick them up. It's quite wonderful.
Yeah, it really definitely helps with the continuity of care here. And another thing I want to touch base on is, can we do any on-site tests here in the facility?
Yes, we can. So we have Gamma Lab. They come in and they draw labs Monday through Friday. We do have the ability to do stat labs with an 8-hour turnaround. We also have Biotech X-ray that comes in, and they do X-rays here as well. We also have say we get an order for an antibiotic at 2 in the morning, obviously the pharmacy is going to have a hard time getting that here in a timely manner. So we have e-kits that we use, and those are pretty fantastic. So we can get that antibiotic started right now. We also have an e-kit that has PRN pain medication in it as well. We just need to let whoever the physician is that we're calling that this is what we have on hand, so we don't have to wait on the script, so our patient doesn't have to be in pain. So that's a wonderful aspect that we have here.
Well, good deal. And one big thing that we all look at, not only the hospitals, but as well as us here in the skilled nursing facility spectrum, is our return to hospital rate. And actually, what is our current return to hospital rate?
I think our current hospital rate right now is 0%. So we try to make sure that we call the physician, and we try to make sure that we communicate well with them, so that way they know they can trust us with their patients. So if they want to say, hey, we need to send them out for, say, a high PTINR, but we can call them back and we can say, but doctor, we have vitamin K. Would you rather us give vitamin K and hold the Coumadin and recheck the PTINR? Because that's something that we can do in-house, and they might not know that, especially if it's an on-call physician. So
Definitely.
yeah.
Well, actually, I appreciate you donating some of your time here to us to kind of give us a breakdown on some of these things. And along with Ashley and myself and the whole team here at WHNRC and Rehab, we strive to make every admission a successful one and a great experience for all the folks that come here, for whether it be short-term rehab, long-term care, memory care, and just to make sure the overall process is very smooth and a great transition for everybody in and out, as well as our outpatient therapy services. So this concludes our time here, and appreciate your time, Ashley.
You're welcome,
So,
Scott. It was a pleasure.
all right, thank you guys for checking it out.